Hemohim. I am really amazed with the wonders that He's doing to me personally, to my family, and to the wonders it is doing to my patients as well. By the way, I am diabetic since I was 40 years old, and I've been on insulin injection for 12 years now, and I'm 62. So you could imagine. No? But this 2 years ago, I was confined because of an excruciating pain in my lumbar spine, secondary to lumbar disc herniation. And I have to be confined, I have to wear corset, I have to undergo therapy continuously. But then when I took Hemohim, when I attended my first ever Success Academy in July, I am now back to my own self, to my daily routine, without doing therapy and without the corset. Let's see. And for all intents and purposes, the Hemohim is really helping us, I mean me and my family, and my family and I are very grateful to the Lord God. And especially to Marlene Casil, who introduced me to Hemohim. No? He is a member of the Ariel Woon Mandaluyong Adja Center. She is God's gift to me. Okay. With my patients, let me share my experiences with my patients. When my patients come to my clinic, I gave them, after giving them the appropriate medicine for their medical complaints, I urge them to take Hemohim for enhancement of their physical well-being. One example of this is a patient of mine who came in September 16, very anxious and worried because she's a case of an autoimmune disease called ITP, or idiopathic thrombocytopenic purpura. Now, this disease is characterized by a low platelet. And there is no specific treatment for this because it is an autoimmune disease. She came to me with a platelet count of 40,000, and you know very well that the normal platelet count is 150 to 450,000. She was worried, but there's nothing I can do about it. What are we going to do? Because there's no specific treatment or cure. Sabi ko, wala namang mawawala sa akin. Okay, I'll give you Hemohim. So I gave her the Hemohim. She took it. September 16, her platelet count was 40,000. September 30, she had a repeat of her platelet. And she came to me on October 1. That's a Tuesday. She was very ecstatic. Sabi ko nga, ang kanyang ngiti, abutin niya. Because the platelet count was 98,000. And this is the first time that she had this. The highest platelet count that she had was 80,000 only. So she was really very amazed with Hemohim. And now she's asking how to be a member. Sabi niya, baka mahal. Sabi ko, walang bayad. Okay. Now, another remarkable case that I have is the wife of my cousin, who is a chronic hypertensive. And because of this, he had chronic kidney disease. She has to undergo dialysis 3 times a week, and to have an injection of erythropoietin factor 3 times a week. You know very well that when you're undergoing dialysis and you have a kidney disease, you are going to have a severe anemia. So, yun ang problema niya. And after each, hirap na hirap siya. So, I urge her to take, try. Sabi ko kahit once. What she did is she took it twice a day. And lo and behold, just recently I was informed that the doctor is contemplating on reducing the number of dialysis, instead of 3 times a week, it's now going to be twice a week. And the erythropoietin factor injection of 3 times a week will now become once a week. So how amazing this is. And now, because of that, said struck up the row, it's sabi nila, and because of this, she's now a member of the Atomy family, our Atomy family, not only the husband and the daughter. You can, because of this, this is very well explained how we are very much in love with this product, Hemohim. With this, sabi ko noon, abangan ang susunod na kabanata, ang sasabihin ko ngayon, marami pang susunod na kabanata. Thank you.